My name is Drew Delaney again with the Public Safety Network. The Public Safety Network is a global advisory consulting firm that helps clients bring life-saving technologies to first responders. We work with countries around the world, as well as some of the leading telecommunications and technology firms that are bringing new and innovative broadband solutions to public safety. So as part of that, we love to get out and talk to both industry and first responders themselves about new technologies that's coming down the pike. So we jumped at the opportunity to be here today to speak to you all about smart EMS solutions and a U.S. perspective on that. So emergency medical services in the United States and what's being done today and what's forward looking for what they call smart solutions for this responder group in the United States. So before we even get into that, wanted to hit a little bit here on really the public safety technology shifts that are happening, as well as what is needed to happen and necessary in order for smart solution adoption, not only in EMS, but across all the disciplines in public safety, and not only in the United States, but around the world as well. So when we really start to peel the onion back here, what we see is first and foremost, adoption of public safety LTE networks. So in the United States, we have the First Responder Network Authority that issued a contract to AT&T to build out the FirstNet network. We've seen pretty tremendous adoption on that network. They've hit over 2 million connections in the little over 3 years since original launch of the effort. We see well over 200 dedicated devices to public safety in the device ecosystem, over 100 dedicated applications in the application catalog. And based on that, we've also seen a lot of the other carriers in the United States respond in kind with their own public safety dedicated solutions. You have Verizon Frontline that's made a lot of efforts recently to launch and educate responders on their public safety offering, as well as T-Mobile offering free service to first responders over a 10-year period, a claim of a $7 billion commitment there. So a lot of carriers out there in the United States really dedicating their solutions to public safety, which is a key shift there in technology to allow for smart solutions to really proliferate in the market. There needs to be an embracing of pricing as a service. So moving on from the legacy purchase of upfront infrastructure costs and really looking at monthly or annual service fees and including all of that in there, whether that's looking at the hardware, whether that's looking at the overall platform, or obviously you have software as a service. But as enterprise has shifted to that space, we're seeing commercial enterprise, we're seeing public safety make that shift. And as that continues to be embraced, another key factor of adoption of smart solutions. A mobile first approach is definitely necessary. That's one of the things that the Public Safety Network has spoke about often in the past. But that's the idea that with on-premise legacy systems, not necessary or not appropriate for field first environments that first responders are. So the ability to, when you think about that next technology deployment, that next network deployment, where is it most needed? And that's in the hand of the responder in the field on scene. So really working back from there and making sure that solutions fit within that approach. Obviously, open standards are critical as a lot of this involves data sharing. So from one software to another, from one even network to another, the ability to have those open standards and have data communicate across platforms, across software, across networks in an open environment really opens the door for competition and really sparks the ecosystem there for smart solution adoption. All of this is also included in cloud services. So if you're embracing as a service pricing, you're likely utilizing cloud service as part of that solution. So when we talk to first responders and there's any sort of hesitance to moving to cloud services where you're worried about security or you're worried about your on-premise equipment and how does that integrate, pretty much everything you do on your smartphone today is a cloud service. you access your email, you access social networks, things like that. Those are all cloud services. So when you relate it more to the actual real life experience of a first responder, you begin to lower that barrier. And again, another key piece to adoption of smart solutions. Simplified reporting. So you'll hear me talk about, as we shift in the next part of this presentation, the operational side of things and the need to really improve those operations. And one key piece is reporting. If you can simplify reporting, whether that's in a mobile app, whether that's in a web-based version of a software platform, being able to simplify reporting is key to improving operations and efficiency and ultimately adoption of these types of solutions. Mobility management. Security is a key, if not number one paramount concern for public safety. So being able to monitor those devices, manage those devices, do that from a remote environment, updating firmware on the fly, all to allow for IT management, whether that's a few person rural department where somebody's wearing a second hat as an IT manager, or a large city department where there's a team focused on IT management. Mobility management, sitting on top of all of these devices out in the field is critical. And overall, the adoption of the Internet of life-saving things, as we like to talk about. So devices that are in the field that can be connected to the internet, where we can extract data from those, like sensors, like heart monitors, things like that. Utilize that data to both inform the first responder, inform others that are part of that larger response ecosystem. So the proliferation of the Internet of life-saving things, packaging those into simple, usable, smart solutions for emergency medical services is one of those key areas that will allow for the adoption of these smart solutions. So with that, I'll launch into, again, we're looking at this from the US perspective. So we'll kind of run through what the operational components are to a 911 response in the United States. But then just as importantly, we'll want to look at some of the things that EMS is doing outside of 911 calls as we look at smart solutions, because that's a growing area for EMS in the United States, especially in how they're utilizing smart solutions. So when we look at operations, it's, I won't necessarily say it's simple. I try to simplify this here, but it is pretty straightforward. There's always been really one main goal in emergency medical services, and that's to get patients the care they need as quickly and safely as possible. Pretty tried and true, no matter what technology you're using, whether it was 1980 or 2020, that's the same goal. We're seeing that shift a little bit, and I'll get into that, but the basic operations, as I said before, you're going to get a 911 call into a dispatch center. The dispatch center will then communicate with and dispatch EMS to the scene if it's appropriate for that 911 call. The ambulance will get that dispatch. They will leave their station or begin to pursue to the scene. The ambulance will arrive. The medics will leave the ambulance to head towards the patient, and with the goal of stabilizing that patient on scene. Once that patient is stabilized, the medics will then transport that patient in the ambulance to the hospital. And then, of course, the medical team at the hospital evaluates and provides the appropriate treatment. So I'll go through each one of these operational areas and talk about some of the smart solutions that are currently being deployed and looking to be deployed, as well as some of the other influences out there that are either driving the market or are influencing the market in some way as we're looking at advancing to these smart solutions. So looking at the 911 call, again, the operation is a call comes into a local public safety answering point, a PSAP, from either a landline or a cell phone. A call taker at the PSAP receives the information, incident information from the caller, and enters it into some sort of data repository. Now, some of the smart solutions that are in this space, now not necessarily directly impacting EMS personnel, but it is impacting the 911 call center and the information that ultimately is received by EMS. So that's why it's critical as we look at these operational components. So the first one is, it's pretty simple, but text to 911, this has been happening for a few years, but of the 6,000 PSAPs that are across the United States, not all can receive text to 911 today, but it is continuing to improve and deployed across the United States. So the proliferation of information when a dispatcher can receive a text to 911, you're looking at data, you're looking at photos, you're looking at videos. So a whole onslaught of new information that a dispatcher will need to receive, will need to digest and determine and decide which actually gets sent out to the first responder, what's appropriate for that responder in that at that time. Another one out there is sensors. So gunshot sensors, they've been around for a long time now, but integrating that with 911. So the second a sensor detects a gunshot, it knows the location, it can notify 911 dispatch, and it can be incorporated into that, that operational flow of dispatch to responder and getting that information out. Another piece is additional data repositories and companies around that, like Rapid SOS, that are essentially gathering as much information as possible that would be relevant to a scene, whether that's automatic crash information, whether that's location information, all gathered in order to better inform the dispatcher as they receive information. So all of this is critical as we look at what type of information is sent to a responder, when and how, so that it can better improve their response times to scene. It can better improve the outpatient outcome while on scene. All of this information is critical to that response. And as part of that, you're seeing an effort in the United States at the federal level to really drive PSAPs to this next generation 911. So the ability to gather all of this information. So there's a effort in the United States Congress right now to pass legislation that would fund PSAPs to upgrade to this next generation capability. $15 billion is in the current legislation. It's packaged with the infrastructure legislation that President Biden is sponsoring. So we'll see how that prevails over as it's negotiated in the U.S. House and then the Senate. And incorporated in that is this notion of moving from public safety answering points to more of an emergency communication center. This is the idea of that dispatch center of the future, if you will, where they are gathering all of this information, analyzing all of this information, and making guided decisions of what information is actually pushed out in the field, automating workflows. So a lot of potential here as these technologies get adopted. It's not necessary that federal movement happens in order for next generation 911 to be deployed. It is already being deployed today in the United States, typically across a state approach or a regional approach. But in order for every PSAP across the country to make this upgrade, there needs to be this federal support. So that's why you see that effort. The next piece is when the responder is actually dispatched. So the operation here is a call taker dispatches the appropriate personnel and apparatus to the scene and relays that incident information to the EMS provider. Medics review that incident information en route. It's provided by computer-aided dispatch system, or it can be communicated over the radio. Some of the smart solutions that are really kind of disrupting this space are this idea of a single pane of glass or a user interface that allows for all of this information to be displayed in a consistent way, both for the responder as well as dispatch, even headquarters or incident command. So you can see everything down to a city block or the entire city. You can pan in and out, and the relevant information is displayed at the relevant time for the right responder. So really integrating everything from top to bottom to ensure that all the information is displayed, shared, and the best response is provided. In-vehicle connectivity is absolutely paramount for any smart solution. So we've seen a vast adoption of in-vehicle routers, providing everything from a single LTE connection all the way up to multiple LTE connections. We've seen technologies launch recently, like high-powered user equipment. FirstNet in the United States is calling that mega range. But what that essentially does is allow for the device itself to operate at 6 times the power. So an in-vehicle router can actually receive a signal from a tower as much as 3 times as far away. So if you can typically get a signal from an LTE signal over band 14 from a cell tower a mile away, you can now get a signal up to 3 miles away. Obviously, that's impacted by propagation characteristics like forestry, buildings, and whatnot. But it's been proven as well that HPUE can actually penetrate building walls better and provide for better connectivity in sub-basements or in parking garages and things like that. So an exciting advancement there in in-vehicle connectivity to allow for extending that range from the device level, so you don't have to wait for the infrastructure to be built to access band 14 in the United States. Drone dispatch. This is another area of smart solutions that's being adopted today and innovating almost on a daily basis. So the ability here to dispatch a drone to a 911 call, obviously much quicker than a responder can get there, so it can provide situational awareness with video. But some things that are being explored in EMS is the ability to dispatch an AED with the drone, so it can actually be dropped on site and can be utilized to save a life even before a responder even shows up. Another piece here is a company called Live 911. They're actually doing direct dispatch of first responders when a 911 call comes in based on the location of that call. So Live 911 is able to know where every responder is, see where a call came in from, and as dispatch is getting that call, it's notifying a responder that's a block away from an incident that just came in over 911 that they can respond, and that responder has the ability to accept that response. So, responders are on scene much quicker in with a platform like this. So a tremendous advancement there. Accurate dosage preparation. So this is the idea that if you have information available to you of the age, weight, other demographic information of a patient, and additional information, so you know what the required medication is, now this provides you with what the dosage is. So you have the dosage ready, you're not fumbling with that after you're on scene. And again, minutes quicker application of dosage, such as an EpiPen, is definitely a life-saving advancement. A key consideration here in all of these solution deployments is what kind of information is necessary at the right time for a given response, because we don't want to inundate our first responders with too much information. We want to be able to have them make quick decisions, accurate decisions, and simplify that process. Now, when the ambulance actually arrives on scene, the medic arrives on scene, they park the ambulance, and they rush to the patient. Some of the smart solutions here, seamless integration and data transfer from computer-aided dispatch to electronic patient care reporting, or the EPCR. This is the software solution that medics use in the field to really document their cases and have that information then shared with the electronic health record on the hospital side. So when we talk about computer-aided dispatch, it's simplifying that data entry, automating that process so that when the medic does arrive on scene, they have all that information, not all, but key information populated in their EPCR to really simplify that workflow and be able to move from transport mode into arrival mode without having to worry about data entry. Connectivity away from the vehicle. This is a key piece to the puzzle here, where if you have an in-vehicle router, you have great connectivity in that bubble. Maybe it's 100 feet, maybe it's extended to 300-400 feet. But when you park that vehicle, typically you exit that vehicle and you're going to treat that patient on scene. That could be in an office complex. It could be in an apartment building. It could be, at a ballpark where you're cannot park close enough to that patient to be able to get the Wi-Fi signal from the vehicle. So responders are left with a couple options, right? There's hotspots out there. You can use the hotspot from your cell phone. You can use a MiFi puck. So there are connectivity options out there, but none of them are as robust as the connectivity that's at the vehicle. One company out there, Ilario, which I'm actually a part of, has tried to solve this solution where you provide the robust connectivity and flexibility of multiple networks that you typically see in an in-vehicle router. Combine that with a battery so you can actually take it with you out of the vehicle and have that robust, reliable connectivity when you're at the patient bedside. So multi-network ability to switch seamlessly between networks, the security of an in-vehicle router with a VPN, all critical for communications, typically, specifically of patient information that's required for emergency medical services. So having that reliable connectivity when you're away from the vehicle so you can connect to various devices as you're trying to actually stabilize and treat that patient when you're on scene, which is the next piece I'll get into. So patient stabilization. This is one area that's actually being innovated around the most right now. The operation here is that medics evaluate the patient, provide the appropriate care on scene with the goal of stabilizing that patient, moving that patient to the ambulance. So as reimbursement models here in the United States pretty much require that that patient is actually transported to the hospital. Whether it's a broken leg, whether it's a relatively acute minor injury, in order to be reimbursed under the current models in the United States, that patient needs to be transported. So there's innovation around the ability to gather as much information about that patient as possible in order to relay that to the hospital so that they are better prepared prior to the patient actually arriving. Another area is actually providing better treatment on scene. So you're not just stabilizing, but you're actually starting to treat that patient in the field while communicating with the hospital. So again, the ability to provide care and continuous care from EMS into the hospital is really streamlined as data shared, as communication is increased. So streaming patient vitals is one area that definitely not only happening in the United States, but happening around the globe, as we're seeing these global patient monitor companies incorporating live streaming capabilities in their monitors, pushing that directly into electronic patient care reporting platforms, and then communicating that back to the hospital. So a hospital's ability to see a 12-lead EKG live, the ability to activate the cath lab that much earlier, really drives improvements in patient care. When you're out in the field, the ability to access resources, so various resources that you might not anticipate, with telemedicine, with that live communication, being able to bring others into that care capability while you're in the field is critical for really improving that care. So all this really comes down to triage on scene with telemedicine. We're seeing it more and more here in the United States, additionally, obviously, around the globe. One of the key components there is a federal model that is currently being pushed. 205 local agencies around the country are deploying this model right now. It's called Emergency Triage, Treat, and Transport, ET3 for short. But it basically provides for a model of reimbursement for EMS to actually treat a patient on scene and not transport that patient, or transport to an alternative location, all with the intent to lower overall healthcare costs, but really empowering that medic in the field with additional resources to make those decisions in the field, to provide that treatment in the field, and empower them to make those decisions, all while being reimbursed on the back end, which is obviously the most important piece here. Another component is some of these reimbursements were actually waived as part of COVID relief. And there's some lobbying within the United States to actually make that permanent. So as we saw with COVID relief, there was a lot of treatment in the field or diagnosis in the field and not as much transportation to hospitals for obvious reasons. So you saw a lot of waivers and approval of those reimbursements. So we're looking at a lot of groundswell here to really secure that reimbursement model to allow for medics to treat in the field, which is really, we're going to see a tremendous amount of telemedicine in EMS when that does happen. Now, when the patient is actually transported, so medics transport the patient to a designated hospital as quickly as possible while providing treatment en route. Again, telemedicine in the back of the ambulance, right? So having that video camera, having an ER doctor basically in the back of the ambulance with you, helping provide that treatment prior to on scene at the hospital. Automating emergency department workflows. We're seeing this already today. So applications like Pulsera in the United States, and they're actually being utilized in Australia today as well. But this is the ability to activate everything that needs to happen at the hospital for a stroke or a cardiac arrest prior to the patient arriving, right? So all the minutes that can be saved, skipping the emergency department, going right to the care that is immediately needed for that patient upon arrival of the ambulance, because of all this data transfer, because of all this telemedicine. These are the smart solutions that are really going to improve patient care going forward. And not going to touch the hospital evaluation and treatment. I'll leave that to the licensed medical care providers, not necessarily in our expertise. And then one area I definitely wanted to touch on before signing off here, but this is for the non-EMS response. So we're seeing a lot of work in the United States today around community paramedicine and mobile integrated health. This is basically taking EMS personnel, medics, and putting them out in the field to do preventative care in their communities. Now, this has been happening without telemedicine, but when you add telemedicine, you add smart solutions into this capability, when you put a physician in the room with that EMS provider, it can really help to lower the overall cost of healthcare as we look at treating those patients in their home where they are, with the expertise of emergency medical services personnel, is really going to show how these smart solutions can improve patient care, particularly in this environment where the chronic patients that actually show up to the emergency room, often we can actually lower those admission rates in emergency departments by utilizing EMS in the field to provide that preventative care. With that concludes my presentation. So thank you very much for sticking around and hearing about some of the perspectives in the United States. If you have any questions, you can see my contact information up on the screen, but would love to be in touch. And again, apologize, couldn't be there in person, but appreciated the time. And hopefully we'll see you guys soon. Thank you. Bye.